Good morning. Welcome,
Good morning.
everybody. Today is with us Arzu Topeli, Chairperson of both Department of Internal Medicine and the Division of Intensive Care of Hacettepe University Faculty of Medicine, Ankara, Turkey, founder president of Turkish Society of Medical and Surgical Intensive Care, former executive council member of the World Federation of Intensive and Critical Care, and deputy chair of Health Service Research and Outcome section of the ASIC. Thank you so much. And the first question is, intensive care medicine is a new specialty. Why have you decided to work in the field of critical care? Thank you.
Thank you so much, Sophia and Francesca. I'm very happy to be here with you, and I congratulate you always for this iWIN initiative, the platform, and thank you for inviting me for this interview. And yes, you're correct that intensive care medicine is a very new specialty, especially in Turkey. It is a very, very new specialty. We worked very hard to make it a specialty for years. And why I have chosen this field, even it wasn't a specialty. Maybe just many years ago, almost 25 years ago, when I was a resident of internal medicine, and I entered that residency, we had an ICU, but we didn't have any education there. The patient care was very poor, and I was very sad for these patients. They were really dying, but they were healthy before getting into the ICU. And it was an open ICU. We didn't have an attending physician, no teaching, no formal teaching, etc. And when I was looking at the, searching, I realized that critical care medicine was a specialty in USA and in many other countries. So why wasn't it in my country? And it was I'm in a good university hospital in Ankara. So I went to United States for 2 months for observership, and I saw that it's a very beautiful specialty. The patients were discharged from the ICU in good shape. And then when I turned back, and then I went there for 2 years of training later on. But at that time, the chairperson of the Department of Internal Medicine offered me to become the intensive care physician of that department and to establish a subspecialty. So, and he was a man, he was a man chairperson. And so he supported me a lot. And I liked intensive care medicine. So I accepted this offer, and I became an assistant professor of intensive care medicine at a very early age. At the age of 28, I was the chairperson of the intensive care medicine, and I tried to establish a closed unit with teaching, and new people entered our department, and now we are getting bigger and bigger, a big family. So that's the reason why I started intensive, and I chosen it.
Okay, thank you so much. What would you like to change in your job in order to improve the work-life balance?
Well, first, I think that intensive care medicine is a very difficult field. So what I would do first is to increase the number of intensivists. And I would definitely, if I have that power, I would positively discriminate this field in the governmental field, etc. Because if we have more people, then we can share the job, and we can share the difficulties, the challenges. But if you are few in number, then it is very, people are scared to get into this field because it's a difficult field, especially young women don't want it because it is difficult. But if we have more and more people, then we can share the challenges or the tasks, and then it can be more appealing. And the second one, what I would do is, if I can increase the number of intensivists, I would give dedicated time to them to be able to do research for other academic jobs, because in Turkey, most of the intensivists are full-time clinicians. They don't have, dedicated time to other research or other academic teaching, etc. Because because we are very few in number. So what I would do is definitely I would give some dedicated time for them, spare time during the job for them to do research, other educational activities, etc.
Well, are there challenges in combining being a woman and a frontline doctor in Turkey?
Well, of course, being a woman in medicine is a challenge by itself, not only in intensive care, but uh, well, of course, there are, especially for junior women intensivists, it is difficult because they have small kids, they have, new families maybe, and so they have social lives. So, uh, and I think that it's a challenge for them. But the major challenge for us is that women have to prove themselves more than men do. We always, um, prove what we do more than the others, especially men. So I think that this is the major challenge. And as we all know, the third one, I think, is that when I was preparing for some the iWIN 2021, I was looking at the Turkish numbers, and in my institution, for instance, um, this is the same everywhere, but the women are not in leadership positions. Mm. In the Department of Medicine, I am the second woman chairperson among 12, I think. We had never had a woman rector of the university. We have lots of professors, but not a single woman rector. Mm-hmm. And only 2 deans, I think. I counted 2 woman deans among 17 faculty deans. So this is a challenge by itself. It's very difficult. You have to work hard for this. It's a difficult task. So I think these are the major ones.
Very few. Have you ever experienced discrimination in the workplace or anywhere else?
Well, as I said, yes, I did, because I established a department of intensive care medicine, and it was very tough. You can imagine that. And I faced with lots of difficulties, challenges from very senior men physicians or directors and so forth. But of course, I had supporters too. Otherwise, I wouldn't be here. But I think that the major challenges were from very elderly men physicians. And I have a small memory, if we have time. When I was doing my rotation in my residency in one of the departments of, I think, the pulmonary medicine, the chairperson was a very senior, very respectful, very good teacher, and we liked him as a students and as residents. And I was the chief resident, and with another chief resident, I was doing rotation there, and he called I think another person told us that he's calling the chief resident to give a task. I think it was something like writing a paper or something, he was going to give us a task. And I went there and I said, okay, sir, I'm here. And he looked at me and he said, I want the man chief resident. Not myself, but the man one. And it was very frustrating. And then I went back, and my colleague went there, and he got the task. And it was this is a small memory, but this is the case we face all the time. And years later, I shared this memory with another woman physician in my institution, and she said, "Oh, he was always like this." But I didn't knew that at that time, and he was a good teacher. He was a good, but when I had a face-to-face relation, I understood this. And it is a very, small memory, but a nice one. And it should not be the case. I think that he should call, he can call the other person, but with the name, not the chief resident, with the name. And of course, it is possible that he can give the task to a man physician, but I think that he should make it more clear, and he shouldn't do it when he sees me. Okay, just call the man resident is not something nice. So this was just a memory.
Thank you so much. In your opinion, what opportunity can the iWIN platform offer for young women who are pursuing a career in medicine? What they can do in order to achieve their goals?
I think it is a very good initiative. I think that it should be more and more visible. The iWIN platform should be more visible and more inspirational to especially young women intensivists at the beginning of their careers, or maybe more younger students or residents, and to support them choose this field, not to step back from intensive care, but choose this field. Maybe women intensivists can give inspirations to those people, and so this is a very good platform. And maybe in the future, if we can overcome the pandemic, we can have more face-to-face meetings, come together, and especially the junior one, physicians, we can come together and with Francesca and others can organize. And so it would be nice to make this field more inspirational and make iWIN a more visible platform.
Okay. I would love to have you over here, Arzu. We're really trying, but the time has been difficult.
I know.
And I know it's challenging. I wish to get younger people, but there are costs. So maybe it's important to try to help them to find the support to come here, even if the Mediterranean is cheaper than the north of Europe. So potentially we might be able.
I know. I just want to say we have to help each other.
We have to help each other.
We have to help each other and support each other, definitely.
And your story is amazing, because what we do as women sometimes is that we feel we are wrong. But then when you hear that something happened to a brilliant, inspirational person like you, then you feel you are normal and the system is wrong. So
Exactly.
Thank you for that. Thank you for sharing. Arzu, it's fantastic to hear you talking.
Thank you.
Thank you for sharing. Thank you really much.
I just have to just a few sentences, if you allow me, Francesca and Sofia. I just want to say that for the young intensivists, what I'm facing nowadays is that intensive care medicine is not popular, and the young physicians don't want it, and especially women. And what I suggest to all young women physicians, that please choose the career that you want, not the people, not, please avoid choosing easy tasks. Just lean in, as Sheryl Sandberg says, lean in, the book of Sheryl Sandberg, the CEO of the Facebook, and lean in, just sit on the table and just do your best. And I think that women should support women more and more. They should be mentors, sponsors, and inspire more and more women, because we need this. We need this. I think women should support each other more and more.
We're stronger together. We're stronger together.
Yes, exactly.
And work-life balance is a problem in the pandemic in Italy, in England too, is a big problem. So
Yes.
I hope that with the meeting on the 25th, we can have some suggestion how to make more livable the tasks that we have at the front line. I don't know what the solution is, but you're right, it's difficult to find a balance, and the solutions can only be found together. Thank you.
Yes. I thank you too. Thank you very much.
Bye bye. Thank you. Bye. Bye bye.
Bye bye.
See you on the 25th.
See.
Bye.